Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. Legislation was passed 2 years ago so the Secretary of State could end profiteering by some drug companies. Now, drug shortages after a no-deal Brexit could mean soaring costs across UK health services. So why hasn't the government set the regulations from this legislation so he can use the powers and avoid a black market in medication?
Hear, hear.
We have already taken action to ensure that the cost of drugs is reduced, and I'm very happy to write to her with the extensive details of the agreements that have been made. The legislation is indeed important. So too is working with the drugs companies to make sure that we keep those costs down, yet we also get the drugs that people need.
Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. As the precursors of medical radioisotopes have a half-life of less than 3 days, they cannot be stockpiled. I frequently ask the government how they will maintain a steady supply if there's a no-deal Brexit. So could the Secretary of State answer, and please don't say seaborne freight?
No, absolutely. We have ensured that there will be aircraft available and air freight to make sure that we can get those isotopes that have a short shelf life and can't be stockpiled, to make sure that there's the unhindered supply. But I make the following point, and I make it to the honourable lady and to her colleagues with an open mind and in a spirit of collaboration, that if she's worried about no deal, which she seems to be, then she and her party should support the government tonight.